Well, good evening. No matter where you are in the world, I wanted to say thank you for joining me. It is always an interesting thing for me to, when I do these webinars, to see how we are connected all over the world. And so wherever you're waking up or you're spending your evening tonight, I thank you for joining. It's my tradition to get started with something that's kind of funny. And being that in the United States, we are just 24 hours away from celebrating Halloween, listen to this lovely joke that I heard. Question: how do you fix a damaged jack-o'-lantern? Answer: you use a pumpkin patch. And I thought that's a cute one that you can share with the kids. It also got me thinking about a lot of the casework that I saw this week in the office. I'm reminded by that song from Tom Petty, "Some days are diamonds and some days are dust." And it felt like today I was doing a bunch of pumpkin patching myself, so I found that one to be humorous. So without further ado, those of you who are interested in the notes, I have a microsite, toothlectures.com, where the notes from tonight's webinar will be posted after the webinar and be available for you to download in your spare time. You're able to review all the material that we covered this evening. I always think it's important whenever you're getting instruction or you're doing any continuing education to understand who it is that's sending to you. And so for those who haven't heard me before, let me tell you a little bit about me. I'm a proud graduate of the University of Michigan School of Dentistry, and yet I practice in Cleveland, Ohio. And most people may be familiar with Cleveland because we once used to have the great LeBron James on our Cavaliers team, who aren't doing so hot since he left, but we wish LeBron all the best. And the reason I ended up back in Cleveland is because this is where I was born and raised. And I practice with my father. We've been together for 12 years, and we finally, I think, have figured out how to coexist and work together. For those of you who are listening who have ever worked with a family member or a parent, I'm sure you have a grin on your face and a little chuckle like, I know and understand. But in all sincerity, it's been more of a blessing to be with my father than anything else, and I'm grateful for his direction in my career. I'm also a clinical consultant for the Dental Advisor. I love it because it gives me the opportunity to test and put to clinical use some of the great products that come to market. And it's difficult, I think, sometimes to know. I haven't met a dentist out there who doesn't want to find the absolute best material, the best way to accomplish the task at hand. And I really do believe that the tools that we use make a big difference. And so I'm grateful to be a part of that and being able to give some of those good insights that us clinicians need when it comes to product selection. Privileged to be a part of that process. I'm a DISC profile trainer and John Maxwell speaker, trainer, and coach. The DISC is a model of human behavior, what's right about us. So much of what we do in dentistry is behavioral, working with our patients, understanding their reads, their tells, the ideas of what they're really motivated to do and how to influence them to our way of seeing things. And I love being able to bring some of that aspect and training to some of my dental seminars, and some of you may have been a part of some of those where we use the DISC as a tool to be able to influence the outcome with our patients. John, he's written 80 books, sold over 20 million copies on the subject of leadership. And to me, leadership's so key, especially in today's freedom of information age where patients can literally look anything up on the internet, and just because it's published there, people believe that it's true. And so we have to use our ability to influence others and pull them to our way of seeing things to help give them the good information that they so desperately need in their decision-making process. I'm also a proud member of Catapult Education. I'm a member of their Speakers Bureau, and It's a collection of key opinion leaders, many who you might be familiar with, who are on the forefront of doing some wonderful things in dentistry. I'm proud to be a part of such an esteemed group, and we're dedicated to really one purpose, and that's quality education. I am not here tonight to sell you things. I'm just here to share some good ideas and would hope that you would treat it as a conversation. That if I was just sitting there with you, I'd be sitting and telling you in private, the same as I'm doing in this public forum. These are things that I love using, and they've given me great success, and I hope that maybe some of the books you pick up along the way will help you as well. And then my story and evolution into dentistry, I'll be brief. I have a long history thanks to my father's guidance and influence. He started me first working in a dental lab as a lab technician, and this was a lab that specialized in pressable ceramics. And so I grew up in the lab industry, got some experience, and then when I worked in college part-time, I worked in an office as a dental assistant. Super valuable. I would encourage anybody who knows someone who's considering dentistry as a career, they really need to go and work on the auxiliary side and see how team dynamics play out in an office setting, because it was invaluable to me. It has a big influence on how I run my business. And then, of course, I got to be the dentist. And so I have been involved in dentistry for now 22 consecutive years. I've really never worked in another profession other than, I believe there was a week that I did work in retail. And I won't get into that story, but I've really only been in dentistry, and I love it. It's really a great profession to be a part of it. So the 30,000-foot view of tonight's webinar is thus: I really see 2018 and beyond as the birth of the Super GP. And what does that mean? To me, that term refers to one who is well-versed in bread and butter dentistry, but is looking into and exploring some of these other areas of interest to bring into their treatment mix. And first would be adult orthodontics. There's many clear aligner systems today that simplify things. I happen to be a big fan of using 6-month smiles, which is a bracketed form, and I really see it's not an either-or proposition. I look at things in this area as it's an and both. I think there's cases for clear. I think there's patients that the only way you'll get a result is to have a bracketed form, so it's nice to have training in both. Endodontics is a great area to get some education. I love what companies are doing, that they are doing their best to simplify and create efficiencies and systems to make endodontics accessible in the private practice today, for you to be able to not do every case that walks in the door, but really you choose with good case selections the ones that you want to keep. And it really is important, I think, to add that into your treatment mix. Sleep apnea, such a growth area, swirling in dentistry. I love some of the stuff coming out about airway and its role in growth and development of the jaw and some of the fascinating things. And certainly I think getting proper training on how to deploy this in your practice is essential. And there's some really great training schools, some certification programs that you can run through, such as one run by my good friend Dr. Erin Elliott. She's got a great program going for those who are interested. So growth area in dentistry, really, really exciting. And of course, oral surgery and implants. I think that a lot of the shift in some of the dental education put on by the implant companies today is putting the shift on actually looking at training GPs. And I look at the implant world as there is enough implant dentistry for everyone to be involved, and that includes periodontists, prosthodontists, oral surgeons, and general practitioners. And if I forgot anybody, periodontics, I may have forgot to say, but I don't want to leave any group out, because, and endodontists, there are endodontists who do it as well. I think there's enough to go around. And these are some great areas for growth in our treatment mix. But my goal tonight is to really teach some pearls for efficient, effective, and profitable practice principles. And when I came up with the idea of this lecture, my thought was I wanted to give a webinar talking and discussing about finishing well. I think one of the things that I see sometimes younger dentists, those who are new out of school, and sometimes those who hit sort of a lull in their careers, we sometimes struggle to finish well. And I'm not talking about finishing and polishing. I'm talking about putting that little extra effort that puts you over the top and takes a case from being pretty good to being just marvelous. And little adjustments here and there, I think, make big differences. And that's really what I want to discuss with you this evening. The first area I want to discuss finishing well has to do with our fixed prosthodontic. I mean, you have to ask yourself some really good questions when it comes to your single crowns that you do day in and day out. It's a large chunk of your practice. Some statistics show it accounts for almost 40% of your practice revenues is doing crown and bridge dentistry. But you have to know where you're at, and you have to know what your patient population looks like. Are you full fee for service, or are you reliant in your patient base reliant on insurance-based dentistry where someone else is footing the bill and providing the benefit, and you have to work within the confines of that allowable benefit? But we also have to think about the difference between direct versus indirect. Certainly when you are doing direct dentistry and you're doing a composite or composite filling, depending on your pronunciation in the world, you have less overhead than you would with an indirect procedure. If you're doing a in a lab in most cases, unless you're in-office milling. But even if you are in-office milling, you have to pay the fee for the block and the oven and the equipment, and all of that comes at a cost. And so you have to consider your profitability in that equation of what am I doing on this patient, what's my profitability per hour for this procedure, what's my operational cost. These are the realities of being in private practice these days. And you also have to measure your efficiency versus your effectiveness score. And what I mean by this is you may say to me, Tim, I'm really efficient. I mean, you should see when I do crown preps, 10 minutes. I'm in and out of the operatory. Everything goes beautifully. I got a system down. But you have to score that against your effectiveness. And what I mean by that is, oh, great, that you may be able to do that. And I think that's fantastic. But when you're seating the crown a week later, 2 weeks later, 3 weeks later, depending on your turnaround time, how efficient is that seat appointment? How long does it take? Is it taking you 15 minutes? And I would give you a very high effectiveness score, because if you're able to pop a tempo off, try in your final restoration, and be off to the races shortly thereafter, you're in good shape. You have a good efficiency system built in. But if it's taking you 40, 50, 60 minutes and you're having to grind in the occlusion and things aren't just flowing and it becomes a struggle for you and the patient, then you have to judge that your effectiveness score isn't as good, and maybe you need to look back on some of your processes. And in the lab industry, we used to have this saying. I remember my boss, Jolt, he was an immigrant from Hungary, and he used to say, hey, garbage in, garbage out. Could only turn out as good of a restoration as what he was given with the quality of the impression. And so we have to keep in mind and understand that we can't expect from the labs to get these really great fitting restorations with everything perfect if we aren't in turn sending them something that we would consider our very best when we're turning it in. I love this quote from Zig Ziglar. He's written tons of books, and he had a great influence on many people's lives, including my own, and this is one of my favorites from him. Repetition is the mother of learning, the father of action, which makes it the architect of accomplishment. And so some of the things I'm going to touch on, perhaps you've heard before, but as Zig would say, repetition is the mother of learning. You can never hear it enough, and I think getting back to the basics is what it's all about. I think the first place to begin has to do with prep design when it comes to our fixed crown and bridge. And the first place usually we begin has to do with burr selection. And for me, in my office, day to day, you come in any day of the week, you survey what I'm doing and what I have on the schedule. Um, I'm going to deploy two types of burrs in my practice. I have a single use burr, single patient use, and those I purchase from Microcopy. And then I have a series of multi-use burrs for certain situations where I'm prepping more than one unit, or I'm going to be removing some heavy-duty crown and bridge work to be able to get access to the preparation chain. I also deploy burrs from Premier, and I like using their two stripers. And in my practice, I have an 80-20 rule. 80% of what I do day in and day out is single patient use type burrs. 20% of the time I'm going with the multi-use. And it really does depend on the situation. Why do I like using single patient use burrs? First, love the idea that every time I take a burr out, not only is it fresh cut and I'm going to get that nice real concentric spin of my burr, but it's also sterile. I think anytime you can introduce clean, sterile instruments into your field, I think it just translates to better dentistry in the long run. But I love this piece as well, the decrease of contamination that you can sometimes run into from improperly cleaned multi-use instruments. And it's not saying that multi-use at all isn't able to be clean and sterilized and properly maintained. But again, the operative word there is properly maintained. You have to measure the pace of your office and what's happening. And do the assistants have the time to be able to get out the special instrument to clean and make sure that your multi-use burrs are cleaned off thoroughly before they get baked in the autoclave, which can sometimes gum up some of those precious diamonds and reduce their efficiency in cutting. I also like the idea that there's less handpiece wear, and certainly I've had to send a bunch of handpieces that are just due for certain things. Just like driving a car, we drive our handpieces every day, and it's costly when you have to get handpiece repair. You have to send out, and you get a pretty good sizable bill. So I like using anything that's going to reduce the wear and tear. That's a good thing for your practice. And ultimately, this reduces your overhead costs. I think some of the, you have to look at the numbers of it, but I think when you start, measuring it out, it turns out that single patient really does over time reduce your overhead cost. The next thing that we transition to is we try to capture an effective impression. And we're taught a variety of methods in school. Most of us are familiar with the idea of a two-chord technique, and I deploy two-chord technique in the anterior. Why? Because I believe that when my social six work is on display for the world, and I'm charged what I do to be able to do the case, it's my responsibility to give the absolute best quality impression that I can, and I think in the anterior you can really, second to none, the gold standard would be a two-chord technique, which is displayed in the picture on the bottom right. You pack a small, like 00 chord, put a top chord over the top, and you pull the top chord after a predetermined amount of time. But some of us use a one-chord technique where you may pack, like on the image on the left, a small, like 00 or 000 chord just to move the tissue that half or quarter millimeter out of the way and get a little bit of retraction, and leave that in and sneak your impression material around because you're going with more of a equigingival prep or slightly subgingival. You can get away with that single chord technique. But some of us use a one chord technique where we pack a 2E, a 2A, a 3A, depends on the sulcus and the patient's tissue. We may pack that in, leave it for 2-3 minutes, and then pull that cord, and after it's retracted, we immediately follow around with some wash material, or we begin our scan process and hope that we get no bleeding and that everything turns out great. But of course, it's become very popular to use some of these pastes and clay type materials that are an alternative to traditional methods. Of course, they're an additional cost, and They're really good at hemostasis on their own, but I would say in sometimes it leaves lacking results in terms of retraction. And of course, most of the manufacturer's instructions, if you read them, suggest that they really would work better in conjunction with a cord. And of course, I've seen that to be the case on occasion. And a lot of them are made with aluminum chloride, which is wonderful at getting hemostasis and works very well at stopping all that bleeding. And of course, there's a dwell time required and some rinsing with water, and that all of them work really well at accomplishing these things. But I particularly have a bias for Traxinant for the reason that I really enjoy the fact that it rinses the easiest out of the sulcus. I played around with the other ones and they all work wonderfully well. They have great attributes. But the one that I admire about Traxinant is the fact that not only is it good at stopping the bleeding, but when you go to rinse, you don't feel like you have to drown the patient to get some of that material out, and that's really a time saver. So it's a great hemostatic agent. You can even use it in some of your composite dentistry. The key is if you have bleeding and you're going to use Traxident, you really want to make sure you thoroughly rinse the prep clean of it so that you don't inhibit any of your bond strengths. That's a real important tip to mention if you're going to deploy it in this method. But really, the take home in using these type of materials is to make sure that you use these wonderful compression caps. This really makes a product like Traxident work phenomenal. When you go ahead and you deploy these anatomic cutout caps, they put that proper uniform pressure all around the sulcus and really open up and make your margins clear and visible, readable, almost impossible to miss an impression if properly used with this technique. They come in a variety of sizes. You can make some adjustments to them, but again, they're anatomic, so they kind of cup out and create that effect to slide over your preparations, and then they put nice pressure and compress some of that material down into the sulcus, and the patient's own jaw is using that pressure. So you get compression, and you get this wonderful hemostatic agent, aluminum chloride, and now you're off to the races. So here's a case where I utilize, and second molar dentistry is challenging because you're working practically sometimes in the throat. You have to contend with the meat curtains, aka the cheeks, as well as the tongue. And some people, as you know, have larger than life tongues. I call them cow tongues. And you really got to wrestle those things aside. And it makes preparations like this a challenge from time to time. And in this case, the way that I go about getting a really nice result is I clearly know that I'm going to be missing some retention on this because of the broken cusp. So I want to do a rough prep, and my idea is to get the prep down about 3/4 of the way finished. As you can see, I didn't round around the distal there because I'm looking at it and know that it's inadequate in its prep height. And I love using SDR. It's a bulk fill composite, but I found that it works as a great core buildup. It's light cured. So what I did is I touched the tooth. I used bonding agent, and one of the ways I'm able to bond so well in the posterior is using fabulous product like Dry Shield here. It's a bite block, cheek retraction, and suction all in one, and it really helps some of those efficiency things, particularly in working on second molars. And there it is in action. Love the product. Really helps you be able to do some quadrant dentistry and some sophisticated bonding without the worry of contamination. So here I am working with it in place, and I love SDR because it's bulk fill. You can fill it up to 4 millimeters all in one shot, cure it, and then I finish my preparation. As you can see, I'm a little sub-G there on the distal lingual margin. And so I go ahead and I use Traxident and put that in there, just let it dwell in there for a couple minutes. And as you can see, after doing some rinsing, using materials like Oxyl Ultra Plus, which is very hydrophilic, even in the presence of a little bleeding and some fluid, you can capture those margins and not worry about missing some critical information. because of the materials, and I love tools that make my job easier. And this translates to a good result with the lab so that you can have quick seat appointments without worry and things working in that nice workflow that we all like to see. And this crown was a full contour zirconia made courtesy of Maverick Dental. A little shout out to Pittsburgh. We stand with you. Great town, great people, and my heart goes out to the people of Pittsburgh and for some of the senseless tragedy that they've experienced in recent days. And our thoughts and prayers are with you, Pittsburgh. So, prep sequence. Now, I look at prep sequence as many people do. We all have our own unique way of doing it, and I'm not suggesting that this is the only way, but I'm showing you the method in which I go about doing a prep so that one can see the reason that I do it. I think it offers some advantages, and I believe in having sort of a mental checklist that you run down and you do things the same way over and over because I believe it creates consistency. And so I would encourage anyone to sort of consider creating a mental checklist of things to do when it comes to their crown preparations. In this case, we had a premolar orthodontic therapy and we did a build-up, and we're now at that appointment where we're going to be preparing the full coverage crown. And so there's the tooth, there's the x-ray. The first thing that I always begin by doing is selecting my burr. And in this case, being that it's a single tooth, I would select a single patient use burr from Microcopy, and I teach one burr design. And the burr design that I like the best for many reasons is the KR type design burrs. That is, they're flat end tapered, but they have a rounded internal line angle. The reason that I enjoy and like using those best is that shoulder type margins today are easiest for scanners to read, which most labs are going on the digital side. So whether you're sending an analog impression or a digital read of your own, the lab at some point is converting your dentistry into a digital platform. In most cases, not all, but in most. And therefore giving them a more readable margin that's more user-friendly for the scanner systems today. I believe that shoulder type look, but if you're prescribing ceramics of any kind, any lithium disilicates or any pressable ceramic systems, you want to have rounded internal line angles to take the stress points off the ceramic so that you don't propagate cracking and internal failures. And so what I begin doing is select a burr, a KR type burr, in this case a single patient use from Microcopy, and I go ahead and I prep the buccal and the lingual. That's where I begin. And the reason is clear on the picture on your right hand side there is because now I have a really good approximation of how much distance there is to slice in between the contacts. I'm not guessing, I'm not starting. You know, sometimes you start too deep into the tooth and you have to make adjustments, and sometimes that creates that J-shaped margin. I just found in my hands, if I do the buccal and the lingual reduction, it minimizes the production of a J-shaped margin because now I can better approximate how much I have to clear in between the teeth. And then I go about breaking contact, followed by reducing the occlusal, and then I look at the prep. And I make an analysis of where do I need to add secondary retention. And so I make my reduction, and there you have it. On the last picture there that just appeared on the upper left, you have an occlusal view of my preparation design. And you can see that on the mesial, I've added a little slot, a little indentation, because I want to add some secondary retention to even this lower premolar preparation. Why do I do that? Well, it goes back to those lectures that we got from our respective schools, from our PROS departments. And when you look at the research on what really causes crowns to dislodge, Wiscott in 1996 determined that, hey, it's resistance to lateral forces, not retention, that is the determining factor in dislodgement. In other words, We don't chew straight up and down like an alligator or crocodile. We actually chew like exaggerated cows. And when you put a bolus of food in between the teeth and we begin to grind and those sideways lateral forces start to bump up against your crown, it's the crown's preparation design and ability to resist those lateral pushing forces that actually retains the crown and keeps it in place. With that being said, if we know, therefore, that lateral forces are what cause crowns to dislodge, and resistance form is the key determining factor from keeping crowns from coming off and keeping them in place like we want them, then the best place for you to locate your secondary retention or grooves would be in the proximal area. Now, hear me, please. You can put them on the buccal and the lingual, and some of us do that because of space requirements or fear of being, if the tooth is too thin in the mesial distal direction, of thinning the tooth out. Putting them in the buccal and lingual still gives you added resistance form. That's the good news. But this may be one you want to remember just in case you ever took a quiz on this, that the best to put your proximal would be in the mesial and distal. So the best place to add secondary retention isn't the buccal and lingual, it's the proximals. That's the best area to put your secondary retention. So with that, I then deploy using Traxident. I practice what I preach. I use this material. I use the compression cap because it just takes that to that next level. And when you rinse it out, these are the results that you're left with. You can see the margins clear, they're readable, circumferential, you don't have bleeding, and now you can go about deploying great impression materials like Aquasil Ultra Plus and getting your final impression, and that transfers to a great die at the lab. Now the key when you send these to your labs, if you're adding proximal secondary, and you can see it's just an indentation about half the diameter of the burr that I selected, the key is to make sure when you send these to your dental lab that you tell your lab to not block out the mesial and distal slots or grooves or boxes, whatever you decide to put in that's appropriate for the material you choose. Because what they will do in a haste, if it's a new hire or somebody who isn't familiar with what that is and how important it is to the preparation, they will take wax or some stone, block out that groove, and now that groove is not reproduced into the intaglio surface of the crown, and therefore the problem that you now face is that that groove that you've taken the time to add and press in the impression, send to the lab, is no longer being represented in the fit of the internal side of the crown, and lost all that beautiful value you tried to add. So it's key to make sure that they do not block that out, as you can see demonstrated by just taking a look at the die here on the model. Now I want to transition to finishing well in another area, and hopefully there's some pearls there on how to finish well in your crown and bridge. Now the next area that seems to be a big growth area, or at least a consistent area where you're producing, is in your composite dentistry. And these are just some wear study slides, courtesy of Mark Latta, showing some composites that are available on the market, all great composites, some market leaders that are out there. And I recently was reading a study discussing some of the changes in filler technology. And I think sometimes we think composites are composites are composites, and I'm looking for one that's easy to handle, and I'm looking for one that simplifies the shading, or one that polishes really well, and we all have our favorites, right? And I found this to be really interesting, that in today's composites, and here's a few of the good ones: TPH Spectra with ST, Filtech Supreme Ultra, Tetric Evo Ceram. These are all in the nanotechnology. And I thought what was interesting, the authors were describing that nanotechnology's particles would be something in the real world. They were trying to give analogies, and they said a nanoparticle on scale would be something the size of a golf ball compared to macro particles that are in hybrid composites and blended composite filler technology that are larger size or something on the scale of the size of a football stadium. And what was interesting in their description is that helped sort of me understand the difference between macro particles and nanoparticles, and that nano is the size of a golf ball and a macro is the size of a stadium. But this is the real take home for me because it drives home the point about finishing these materials really well. They took the position that if you were flying in an airplane in this analogy and you were looking down over the ground, it would be hard at 15, 20, 30,000 feet for you to look down at the ground and for you to see the divot of a golf ball. But you certainly would notice if a football-sized stadium was missing. And the reason that they discussed this, and I found to be fascinating, is that they were using it in describing finishing and polishing steps with these materials and how important it is that we choose the right products for the materials that we're working with. In this instance, they showed that, hey, polishing composites with larger filler particles, one of the drawbacks that we can run into is that when we take our polishers across the material, some of those football-sized stadium particles can occasionally be plucked out by our polishers. And when you would fly over that surface, you would notice if a football-sized particle would be missing. It would lose its luster. You may notice pitting in that material, as opposed to when you're working with nanotechnology and nano-filled composites, in this case like TPH Spectra with Sphere Tech. This is all small particle, and they have superstructures of spheres, but it's all made from the same primary particle. And so when you use the proper polishers and finishers using these materials and you go across the surface, you don't have any of these large particles pluck out. You have all these small golf balls still, and from a distance your eye detects no irregularity. Just like if you were flying in an airplane, you would be hard-pressed to see the divot from a golf ball from 10,000 feet and above. That's the beauty of nanotechnology. Using smaller particles and using proper finishers and polishers, you can get some really outstanding results when you use the right products. So I love to use products that were designed for nanotechnology, and I love using these minnow polishers from Microcopy. Again, they're single patient use, they come sterile in their packaging, and their small designs afford me some great access to some tough areas and create some really nice results. Now, there's a big difference between finishing your composite restorations and polishing them. In these nice side-by-sides, you see finishing is really what I would call getting it about 90% of the way there. And the way that I go about utilizing that is using carbides. I believe using aesthetic finishing carbides, 12 fluted. I love using those because you can create really smooth surfaces to begin with. You can start to really get some of the gross reduction down and create really smooth surfaces, as you can see, compared to using diamonds. And diamonds are okay to use, provided that you understand that you have to do a little more work to get some of the surface pitting out, as you can see in this 60 magnification showing Filtech in this case being used with a carbide blade, create a nice smooth surface, and then using a 30 micron diamond, you can see the difference. Polishing is where we're going to take it to that next level, where we want to really reduce any pitting at the surface and really create high surface luster. And you can see in the middle it comes in two flavors, if you will. The satin finish, which is going to give you more of a matte finish. It's really ample for most of our posterior stuff. And then they offer a high gloss, and I deploy the high gloss anywhere that the patient can see it. If that's a lower posterior molar and they're going to open it up and they're going to look in the mirror and point out, I want to make sure that I get it as smooth as possible. so that it passed not only the eye test, but most importantly that it passed the tongue test. I usually will tell my patients, run your tongue over the surface. Tell me if anything feels sharp. You want to really utilize your patience when it comes to polishing because they will detect any little nuance, any crevice in there that you may need to go back and revisit. But it's all about using the proper materials. And again, keeping that plane analogy in your mind that it's really hard to see surface defects when you're using the right materials and you're really polishing those surfaces to a high shine. So I thought we'd wrap this up by doing a little walking through some cases. This is quadrant dentistry at its finest. We have 2 failing silver fillings. The patient actually on the back one, she wanted that one removed. I think it could have got a few more years out of it, but she wanted it removed. And we were doing a crown on 19 there. And so we started off removing the silver filling and again deploying dry shield so that I can get great isolation in there, and took out all of the old filling material. And then this is using Theracal, a lovely little product just to help with some of that deep dentin, deliver some bioactivity potentially to that area. But I also like the fact that it's stark white. And the fact that it's white is I can block out and use it too as a block out, not just as a liner, but also as a block out material for that discoloration so I get a better aesthetic result. And here we are after the composite's been placed. And now I go ahead and I got all the silver there. And again, my favorite material to use for really speedy core buildups. I get all the old material out, and then I like to use SDR from Dentsply Sirona. It's a light cured bulk fill that I find a variety of uses for, not just using it in standard class 2 dentistry, but also using it in crown and bridge for a nice core buildup material. Finalizing the preparation there, then going ahead and capturing a nice impression to be able to send to the lab and fitting the patient for a temporary. Now the patient's back a couple weeks later. I like you to take the note of the back restoration, just the surface gloss, just using these minnow polishers really makes these nano-filled composites come to a high luster and shine. And there we are, final restoration seated for the patient. That's a full contour zirconia crown. I was able to cement that conventionally because one of the beauties about taking the time, adding a little extra second tension groove or slot in the proximal, is that it also simplifies the cementation steps for the dentist. You no longer have to worry about the crown preparation being lacking in retention and have to go to higher strength alternative cements to be able to retain these zirconia crowns. You can go back to using conventional cements of your choice, and you're going to get great results. And there's the final from the buccal. Here's another. I was doing a little demonstration using a little short dental dam, and in this case there was some decay underneath in the proximal area. And final here, just to show the surface luster using nano finishers and polishers when you go with a carbide to do your finishing, and then you use proper polishers like the minnow from Microcopy that are designed to work with nanotechnology composites. These are the kind of results you get with minimal effort. I mean, no one wants to spend an abundance of time trying to make the restoration come to a high gloss finish, but it's simple and it's easy to do when you use the right materials. Checking the bite, I used to use a variety of carbon papers, one that was thick. I used to buy Parkel's AccuFilm because I liked how thin it was, and then I found a product that eliminates the need for holders and is thin like AccuFilm, and it's single patient. If you notice, there's a theme in my office. I love materials that I can use, and then afterwards it makes for great cleanup for the assistant to be able to pitch these things. But I really like this as a clinician because this is thin mark paper, and I like that thin marking paper because it shows me some of those details that I need to be able to make a proper bite adjustment. And one of the ways that I check bite and really make sure that I get an accurate bite registration, this is a key pearl. Always make sure that you wipe your carbon paper down with a thin layer of Vaseline. Thin layer of Vaseline activates the colorant and it transfers it to the tooth and makes it stick, so that the only way that the colorant from the marking paper can be removed is either you prepping it with the burr to adjust the occlusion or a vigorous scrubbing with a 2x2 gauze. So no longer, this is the scenario that at least happens in my office. You usually will dry the teeth. You'll try to get the patient to put the carbon in and mark. And the first thing that they do after you dry the teeth is they immediately lick their teeth with their tongue and re-wet the area you just tried to dry. And so rather than, try to instruct the patient, take of it, put a thin layer of Vaseline, and then again, remember deploying aesthetic finishing carbides like the NeoBurr from Microcopy. I love using these because they're single patient use, super sharp, make great smooth cuts across the tooth surface, and really get me about 90% of the way home in terms of creating a smooth surface luster that the patient's tongue is just going to glide over, and they're going to report, wow, that feels really, really good, doc. And again, I think the best way to finish is to deploy using aesthetic finishing carbides that are 12 fluted or more. However, some of us like to use diamonds, and I would say you can use diamonds, but I would encourage you, if you're adjusting occlusion, particularly on a zirconia crown, if you use a super coarse grit diamond or even a medium grit, good luck at trying to get those striation adjustments out of that zirconia. It's next to near impossible. You really need to deploy using superfine grit. Superfine grit is either white, some companies sell them in white, some in yellow. There's all different colors, but it's the step above fine grit. So usually we have super coarse, coarse, medium, fine, and then you really want to use superfine grit ones when you're doing your adjustments to zirconia crowns, to your porcelains, and to your nano composites that you're using, because you don't want to create striations in there that are going to be hard for you to polish and smooth out. So you want to use aesthetic carbide finishers or superfine grit diamonds. So here's the review of this evening's program, the take-homes. Number one would be, keep in mind to finishing well anything you're doing, remember your tried and true prosthodontic principles. If you spend a little more time in the preparation, if you just think it through, got everything I need to get a well-fitting, well-retentive crown, and is this thing going to last, and am I not relying solely on the glue, I think you're going to have great success with your crown and bridge. I would encourage everyone. There's some amazing products out there that really make the job that we do every day better, and it's done faster. And so if you're struggling in an area, consider switching or asking for a sample of a product, even if you just want to try it out. These are good things to do. Tools really do make the job easier. And I love this because I really borrowed this from one of my clinic instructors, Dr. McLean, because she used to tell us before we would do any of our practicals, she says, listen, I know you're all out here and you're working hard, and you're going to try to make us proud and do a great job. But keep this in mind, if you can't make it fine, make it shine. And I always love that, because sometimes in a procedure, it doesn't always look the way you dreamt it was going to look, or sometimes just the way that the tooth's occlusion is, you really had to grind some of the anatomy you tried to build in. But at bare minimum, if you can't make it fine, make it shine. And before I take some questions, I'll leave you with this thought, because I love this picture here. Some days I feel like this guy. I feel like a turtle propped up on a fence post. And I won't bore you with details, but when I got started doing a career in lecturing in addition to full-time practice, I ran across a dentist who told me this story about when his dad used to work for the railroads, he'd come across this scene on occasion, a turtle propped up on a fence post. And he would ask him, do you know what that means, son? And this dentist said, I didn't have a clue what my dad was getting at, but he knelt down and he said to me, son, the turtle did not get there all by himself. And it gets me to thinking from time to time, twofold. We don't arrive anywhere in a procedure without using multiple products and going through multiple thought process and a checklist of things that we have to do. And I'm telling you, there's some really great products out there, but on a deeper level, none of us get where we're at in our life, our careers, with our families, our loved ones, all by ourselves. We've had lots of help, myself included. I've had many people pour into me over the years, mentoring me, loving me when I was unlovable, treating me well even when I didn't deserve it, or just giving me some pearls and insights. And so before I take questions, I just wanted to leave you with that thought. Be mindful of the people that have helped you get where you're at, because we practice in a great profession. And I really appreciate the time that you've all got to spend with me this evening. And beyond today, this is my contact information where you may find me. You may have a question for me and think I might be the person to turn to for an answer. And you can go to me on Facebook. You can tweet at me. Toothlectures.com is where I put the lecture notes. They are there now for you to view if you so choose, as well as some other good things. And you can always email me at toothlectures@gmail.com, and I will do my best to reply back to you within 24 hours. And so without further ado, I am going to take a look at some of the great questions that have been asked. And let me scroll through here and see what people are asking. Okay. So I have a question that says, on the premolar, where I was demonstrating my prep sequence, there was an endodontically treated tooth. Yes, it was. And the question was, why didn't I place a post into the tooth to increase strength of the remaining tooth structure prior to crowning? First, let me say that I think what you meant is to give strength to the core, because post-preparation actually removes tooth structure and does nothing to really reinforce the tooth. A post is going to give structural reinforcement to the core. And so I think that's what you're getting at. And the answer to you was, just like you are, I am learning sometimes from the error of my ways. Today, according to some of the research that I've read lately, there is a benefit, it appears, putting a post into endodontically treated premolars in nearly every case, whether you are covering with full coverage or if you're going to be doing some form of direct composite as the final restoration. And so initially, the reason that I didn't put a post in there is because I have a bonded core, and I went a little bit into the post-preparation space, but looking back at it, if I could do it differently, and there's many things I could say about my career when I look at some of cases I've done throughout the years that I would have done differently, I would have gone and put a post into that too. So good catch. I was hoping somebody wouldn't notice it, but yes, I would have liked to have done that for the long term, because there's a chance that somewhere down the road, and this case has been in for a couple years now, and knock on wood, no issues, but there is a possibility of that crown breaking off if the forces get too great. The one thing that I did have going for me on that premolar that I failed to put an endodontic post into is that I had ferrule. And that is that I had a 2 millimeter band of tooth structure all the way above my margin that was at least 1 millimeter thick in all dimensions as well. And if you have adequate ferrule, you can sometimes get away with having no posts, and yet I can say if I had to do it again, I probably would have gone and put a post. So thank you for the question. That was a good catch and a good one. Let's see. All right. That seems to be all the questions that I have for you this evening. Um, I appreciate everyone taking the time to come out, and be sure to take your quiz at the end and get your credits. I appreciate you listening, and wherever you are in the world, I wish you nothing but the best. Drill on.